whilst I say I love working with a range of different challenges, I think one of the challenges, and being a nurse from a BME background, I think it would be false if I don't mention that there are often challenges related to race issues. And I think that for me is one of the biggest challenges that I've had to face in my nursing career.
Working for the NHS is really challenging, and we're constantly up against lack of resources, and obviously the past 2 years have been a huge challenge for everybody working in the NHS. I think one of the biggest challenges for me throughout has been about maintaining my staff's well-being, as well as continuing at a brilliant level of service that we usually offer.
I think the biggest challenges that I faced are around when the system doesn't do what the system needs to for the patient, and the patient's failed by that system, and I find that particularly difficult. So you are only a part of that system, and you can only play a certain role within that patient's care, and when you're reliant on other elements of the system, whether that's other nursing colleagues, whether that's other MDT professionals, or whether that's non-healthcare related services at all, you know, and they don't fulfill their part of that journey, and the patient doesn't have the best outcome because of that. I think I find that the biggest challenge, and it's taken me a long time to realise that while ever nursing is core and fundamental to lead care, and we are that glue that holds all those professionals together, we can't always make other people do what is needed, you know, and we can't control the whole thing.
I started this role just as COVID hit, which had a massive impact obviously on our training, the ability to train all staff throughout the hospital and the trust, with having all the different guidance that we had to follow, which at times did stop completely all our training, which then as COVID started to sort of move away, we had then a big challenge of trying to train all the staff that had gone sort of out of date, as well as continuing to train staff that were due their training. So yeah, definitely a challenge that we've faced recently, but it's something that we are getting through, and it is going well.